Yes. I'm really, really excited to meet and introduce you all to my friend from the North, Dr. Maryna Mammoliti, who is coming to us from Ontario, Canada. She is a psychiatrist and a coach and a mom, and she, like many of you, does it all. And we're here today to talk about boundaries. Dr. Maryna, nice to meet you. Thank you so much for being here.
Hi, nice to meet you too. Thank you so much for having me on your podcast. I'm looking forward to talking about boundaries tonight, especially for our moms and professional women.
Yeah. So I have so many questions. You are a coach for high achieving women professionals, and you essentially have kind of come to this niche of helping people set boundaries, and in order to create kind of a life that works better for them, kind of get away from constant people pleasing, constant yes, in an attempt to help everyone else. Meanwhile, we're suffering and struggling. So as a psychiatrist, how did you land in this kind of arena? How did you end up coaching women in this aspect of their lives?
Well, actually, as a psychiatrist, when in doing psychiatric training, we do a lot more training of boundaries than an average physician, just because of, like patients, especially when you do therapy. I do a ton of therapy. So boundaries for me is a small, actually, portion of the skill set, right? As psychiatrists, I help by doing therapy, but not everybody needs therapy, and especially boundaries that might be in the context of workplace, or boundary that could be in the context of parenting, stuff like that. Some people need therapy, some people do not, right? That's where you kind of have to differentiate between, is it an issue that is kind of a diagnosable, condition that requires treatment, including therapy? Because I do both. I do psychiatric care and therapy, and most psychiatrists are capable of doing therapy. It's just some choose not to, or some are not able to due to employment. But as a coach, I usually work with people who do not have a diagnosable mental health condition, and we just focus on, kind of optimizing their function through realizing boundaries and kind of figuring things out. So the way I like to kind of explain to people in terms of boundaries and coaching, psychiatry, whatnot, it's kind of like this. Imagine if you wanted to buy a house, right? And you're looking at your finances, and sometimes you have like debt and you have some struggles, and you actually need to go to financial advisor to help you figure out how to get your finances in order before you could qualify to a mortgage. And sometimes your things are in order and you just go to a kind of mortgage advisor and you apply for your mortgage and to see what you qualify for. So it's kind of like that. Some people have the finances in the state where they need a financial advisor before they even need to move on to the mortgage advisor, because there's some difficulties they need to work on. So that's therapy. There's issues we have to work on, versus other people who things are kind of okay and they just proceed straight to the mortgage advisor to see what's possible. Well, that's kind of like coaching, right? And so that's how I tell people kind of the difference. And so how do I come about doing boundaries? Well, again, a lot of my patients are professionals, professional women, especially physicians, but I also have, a lot of people I work with who are lawyers, dentists, teachers, nurses, again, teachers a lot too. Without boundaries, they burn out too. So it was very clear that, boundaries is a big issue for many people. And especially after as a psychiatrist, after I treat their, condition, and then we're working towards wellness, that will be part of wellness building for them. But definitely for people who came in just for coaching, who want clarity or want to switch careers, or are trying to take charge about careers, or readjusting in their roles in life. They might be going from one role to another, a career change, potentially becoming a parent, or really wanting to have a different life than they have. Boundaries is often a key aspect of that.
I think it's incredible that as a psychiatrist, you can kind of approach from a medical perspective and kind of identify whether or not there's any mental health conditions that need to be addressed first before you get to the point where you're talking about optimizing. Because a lot of people have, I'm sure, undiagnosed or undiscovered or unexplored emotions that are contributing to problems that are affecting their life. And those need to be unearthed and addressed prior to even talking about optimizing their lives.
Right. And so I guess talking about boundaries, right, I keep those two very separate. So if somebody's coming to see me as a psychiatrist and therapist, then we do all of that. If somebody's reaching out to me as a coach, I'm very clear that I'm not acting in the role of a psychiatrist,
sure,
that we're only focusing, right? And if during intake session, I become more concerned that this is, more representation of something else, I will, keep up the boundary of what I'm able to offer and say, look, I think this is more than coaching, I needed to go and see somebody else. I will not diagnose when I do intake for coaching. I keep up my boundary between those two roles, but obviously, again, I am very clear of boundaries between the two positions that I occupy. So
Sure.
again, I guess sometimes it's the opposites being true. Sometimes it really helps to identify what is what, but also it makes it difficult for me sometimes because
Sure.
people come in and they're like, well, I think I just need boundary work. And I'm like, you know what? I think this is more than boundary work. This is outside of scope of coaching. You
Yeah.
need to go back to your, kind of therapist or whatnot. So and sometimes people get disappointed, but it's really me reinforcing the boundaries, what I think is appropriate for coaching and what is actually treatment, because those are two different things.
Yeah. I think the word coach has come up a lot lately. And there's a lot of people out there in our space, especially the women's health space, who are offering coaching. And I think that people sometimes get confused between, what is physical or mental health treatment from a physician versus coaching, which is more of education and support, through, life changes or through a health, navigating a healthcare journey or a medical condition or something like that. They are definitely two separate roles. And I think that sometimes people don't even know where to start, like when they need a coach or when they need to find someone to help them learn the skills, to deal with whatever they're dealing with. But we're both working moms. We both have kids. We're both physicians and, high stress environments, high stress careers. And so when you use the word boundaries, I feel like most of the women that I speak to, colleagues, friends, patients, we're kind of conditioned to be people pleasers, to say yes to everyone. We want everyone to think highly of us. We want to please everyone. We want to be able to accommodate everyone with what they need. And a lot of times it's at our own expense. It's at the expense of our mental or physical well-being, meaning maybe we don't, get enough sleep because we overcommit, or, we're saying yes to things that are not serving us and are actually draining our resources or draining our energy, or are not bringing us joy. So when we talk to the women who are listening, how do you define what are boundaries? Where should they exist? And kind of at what point in your life do you start to incorporate boundaries?
Okay, so this is an awesome question. I love it. So first of all, I think you're pointing out a big thing is that unfortunately, this is the whole gender bias piece as women, right? It is the moment that we enter a role as a woman, whether the role of a mother, the role of a friend, the role of a partner, wife, physician, teacher, colleague, business owner, whoever, right? Unfortunately, the gender bias really precedes us in terms of what people see as a nice woman, right? A nice mother, a good mother, a good friend, right? And often for women, that means not having boundaries. That means, oh, you're so kind, you're so pleasant, you're always available, right? Think about the descriptions you hear. Oh, look at how kind this person is. They're always there for me. Means no boundaries. You're always available. Yes. Or, they'll give the shirt off the back of their bag or anything like that, right? So we really have to understand that that is part, unfortunately, of gender bias. And that the moment that a woman says no to anything, it might be to a second offering you food at a restaurant, or even the food that she chooses when she's out with friends and she says, no, thank you, I don't want pasta, I'd like this. That no almost challenges of how people see a nice woman to be, or a good woman to be. Or, and again, a woman saying no could be seen almost like as an assault to some people, right? And cause all this, really kind of this reaction. And so for women, it's really difficult to say no, because so much of our identity as a female has been on being pleasing and saying yes. And then the moment we say no for something as small as the meal we order at the restaurant, or suggestion that somebody gives us we don't want, or parenting suggestions, right? Right away, all of a sudden our identity changes from a good woman to difficult, or what's wrong with you? Why would you say that? Why would you disappoint this person? Or you hurt them by saying that, right? Like that no becomes an assault on somebody's advice, or somebody's expertise, or somebody's whatever. And so just understanding how inherently difficult and conflicting it is with the identity that society wants us to have, let alone if there's a hierarchy of some sort, like in medicine, for example, right? There's so much hierarchy when we go from medical student to resident, and there's hierarchy in other organizations, right? That sometimes you're not in a position to say no without having huge consequences to your no, like potentially losing your job, losing your friendship, right? Or being labeled as difficult, uncaring, not a team player, or, overly confident, again, like being labeled as something defective of some sort, right? So right there is really a huge step to understand for women why it's so hard for us. And part of the reason why it's so hard for us is because most of us did not grow up being able to say no, right? Our parents didn't allow us because they were also, kind of doing that whole people pleasing. If we didn't want to say hello to a neighbor, if you didn't want to hug an uncle or whoever, right there, there was something wrong with us. And we disappointed somebody, and we disappointed our parents because, our parents felt bad that we didn't go along with something said. I'll give you an example. I was, at the store with my kid. My kid was in the shopping cart, and the cashier starts talking to my child, and my child's not responding. And she says, oh, you have a shy child. They're not talking. They don't want the sticker. And I said to them, why would they talk to you? You're a stranger. I tell my children, don't talk to strangers for safety training. You are a stranger to them. Why is your need to talk to them overrides their boundary and all the teaching I said of safety? Why are they going to talk to you? You're a stranger to them.
Yeah.
And it's not being rude. It's just they're following what I told them, right? And that's how basic yet how complicated boundaries are, and what we expect of children, what we expect of women, and why a lot of us struggle with it, because we weren't given that as children, right? And then we grow up into adults who every time we say no, everybody looks at us like something's wrong with us, right? So it's difficult for women, especially professional women. If you're a lawyer, if you're a teacher, if you're a nurse, if you're a physician, it's really hard. So there is that. When you talk about boundaries and understanding boundaries, I use this example of my cat and a dog. I have a cat and a dog, and when they lay together, occasionally they do, you could clearly tell who is who. The fur is different, the fur texture, the color is different, their shape is different, right? So you could tell the boundary where one ends and the other one begins. You could totally tell by looking, by touching, you could tell. So boundaries is kind of that. Boundaries defines who we are. Boundaries is what tells you where I end and you begin. If me and you were sitting on the sofa together while doing this podcast, we would be able to tell where your body ends and where mine begins, right? Because there's a difference in shape. Even if we wore the same clothes, right? There's a difference between us. So boundaries help us differentiate one person from another. Boundaries helps us also have some predictability and expectations and rules of engagement with one particular person. So another way I give you an example of what boundaries are. Think about border between Canada and US, right? It gives you a clear boundary between where one country ends and another one begins. So there's that boundary. Also, depending which side of the border you are, you're going to have to follow different rules driving. When I cross into Michigan, I have to switch my car into miles per hour and look at the speed limits posted. When you cross into Canada, you have to do the kilometers per hour. So those are boundaries that go along with crossing the border, and the boundaries of the speed limits. So that's what boundaries are. They define who we are versus who somebody else is. They define our needs, our abilities, our limitations. They also define almost like rules of engagement with people about what we'd like or we don't like, or what the expectation is.
Isn't it incredible that simply saying no and asserting that boundary, and as you describe, I'm thinking of this conversation in terms of women and, specifically, working professional women, but when you relate it back to as early as childhood, the expectations that adults have for children, or the expectations that others, colleagues, friends, family members, employers have for us, it's incredible that something as simple as saying no can be an affront to other people, that other people are offended by. And that is really on them, because they have an expectation of how we're supposed to behave. They have an expectation of how a woman is supposed to respond, or how a child is supposed to respond. And anything that doesn't really fit their expectation can be seen as offensive. And I think that that's it's kind of really, really incredible. And these are the cultural norms that have developed over time that makes it now difficult for us when we do want to assert ourselves, when we do want to say, these are my boundaries, this is who I am, this is what you can expect, this is what I'm willing to do and not willing to do. And that makes me difficult.
Right. Because do you see how our boundaries are meant almost like a fence that defines who we are. It's
Yeah.
not a barbed wire that's meant to harm or punish somebody. Yet many people see our boundary as a barbed wire that's keeping them out or punishing them. And that's their perception of our boundaries. The other thing with our boundaries is that our boundaries inconvenience other people, but that's life. Life is about disappointment and convenience. Yet people are, take that disappointment as a personal insult or
Yeah.
personal rejection. Again, like I give people an example all the time. You're trying to buy a house. You make an offer and it's rejected because your offer doesn't meet what, the seller wants. We don't usually take it personal and say, oh, well, the seller hates me, Maryna. We usually say, well, of course the seller wants the most money. They got 20 offers. Of course, they're going to go with the highest. It sucks. I'm disappointed. I'm annoyed. I have to go back to the drawing board. I put all this time. I don't take it personal. I don't go around thinking they rejected me. I lost. But when people tend to set boundaries, this is a problem. Others see it as a personal rejection. How dare you reject me? How dare you reject my advice or my offering you of pie, or my offering you whatever. It's kind of like if somebody comes, think about food and boundaries, especially for women. You come over to somebody's house, you're not hungry, or you just came over to hang out and talk, and they bring you food. You say, oh no, thank you. No, you have to have some food. No, thank you. I'm not hungry. What, you don't like my cooking? Or let me order something else. No means no. I just don't want to eat. Right? Think about the food, the relationship with food we have, and how people don't take no for an answer.
I'm guilty of that. I have to say I'm Italian and food is my love language, and it's funny because we're talking about us setting boundaries for ourselves, but you put it in perspective of us being conscious of other people's boundaries. I certainly take it personally. If you come over and you're not going to have, my macaroni because I made that with love and it's for you and I want you to enjoy it. And so it's interesting that kind of juxtaposition. We're here saying, I want you to respect my boundaries. And yet we also have expectations of how others are going to behave in our presence, in our homes, how our children are going to fall in line with what we expect of them. So it's a really interesting point that you bring up.
Food is a huge issue in many cultures. And, my last name is Italian, so I live in an Italian family. But, with the food thing, if you asked me if I wanted macaroni and I said, oh, I'd love some, that would be awesome. But again, that's the alignment between the needs and boundaries, because, what I want to give you may not be what you want. And that's not a rejection of the macaroni. It's just, I'm not interested in macaroni. And that's the key. It's an alignment between the needs and boundaries.
Yeah. It reminds me of the book, The 5 Love Languages, which my husband and I read together, and we've read the book about the love languages of children and how we all give and receive in relationships differently. What we want and how we want to be loved may be different than how we offer love. And if there's a disconnect between what we want and what we're receiving, it can cause tension and it can cause, difficulty in communication and expectations. It can cause frustration. It's interesting that you bring that up in terms of food, because I hadn't thought of this conversation as what boundaries am I not respecting? To be honest, I'm thinking of this conversation as I am woman and I am going to set my boundaries and you're going to have to follow them, like it or not. Again, sounds awful, sounds offensive, but that's how I was approaching this conversation. And it really, you've brought it to light that it really does go both ways, that even though I'm a woman, and even though I want my boundaries respected, that I have to do the same for others. So it's really interesting.
And we all have different boundaries, right? Like, we're all different people. Look, my cat and dog are different animals of different shapes. They're all different boundaries. So everybody has different boundaries.
So, we're raising our children. Do you have daughters?
I have 1 daughter and 3 sons.
Wow.
I have 4 kids.
Yeah. So I have 2 daughters and a son, and a lot of people out there who are listening are also parents. And, we kind of live in a day and age where we're kind of encouraging our children to assert their boundaries, assert what they're willing to do and not willing to do, and asking other people to respect that. Meanwhile, as we were not raised like that, we were raised to be obedient and kind of, go with the flow and don't upset anybody, don't cause any waves. And so my question to you about setting boundaries as an adult is, if you're not a person who grew up empowered to announce or identify your boundaries, to say no confidently. How as an adult can you start to gain the confidence to say what you're willing to do or not willing to do, what you're willing to accept or not, behaviors that you're willing to tolerate or not, relationships that you're willing to participate in. If you've not been raised with that confidence as an adult, it can be difficult, especially like you said, when you're in a position of where you're lower down in the hierarchy and you need to say no to someone who is asking something of you and they are your superior. So how do you gain the confidence to begin to assert your boundaries as an adult?
Okay, I'm going to give you this. Some of us did not grow up with parents who had financial knowledge or financial skill. Does that mean we continue doing the same thing? Or do we go and we take a course, we learn, we educate ourselves, right? So it's the same thing with boundaries. Boundary setting is a skill. Being able to understand boundaries, being able to tolerate the cost of setting boundaries is a skill.
Yeah.
Just like learning about finances. Nobody tells us, oh my God, I love learning about finances, unless you're a finance major, right? Yeah. Or like economics major. But most of us don't love learning about finances. I don't like learning about EFTs. I don't like learning about all this stuff. That's not my life. Do I have to? Not really. Would it benefit me? Yes, absolutely. It takes time. It takes effort. I have to go take courses. I have to go look up, read, right? Like I have to invest myself in learning this. So here's the thing. It's the same with cooking. It's the same with any other skill. We don't often have as much judgment attached, although finances, have a lot of judgment. People feel very, lots of shame and all sorts of emotions around the finances.
Sure.
At the same time, most of us are going to take some kind of course or some kind of, read about finances so we can change our situation versus what our parents did or didn't do.
Yeah.
And we don't blame our parents because our parents did the best they could based on the circumstances they had to live. So with boundaries, it's the same thing. We're not going to blame our parents for not giving us what we didn't know and the society we lived in. We need to learn how to set boundaries. How do we learn? And so we can teach our children how to, right? Sure. Because again, as a parent, there's lots of boundaries we have to set. Even with my own children, huge, we have to set boundaries with our own children, about what's possible because we have to give them healthy disappointment. And healthy disappointment comes from boundaries. Because, life is full of disappointment. They're going to be disappointed in life. They need to get used to it. They need to problem solve. Disappointment is not abuse, especially when it's predictable. Disappointment means, we're not able to do this now. We're not able to buy this toy now. We have to delay problem solve. But going back to boundaries, to know how to set a boundary, you truly have to get to know who you are. Again, back to the whole financial comparison. To be able to buy a house, you need to know the state of your finances. You need to know your tuition debt. You need to know your debt. You need to know your credit score. You have to look at painful stuff. You have to look at that. You can't go and apply for, you can apply for a mortgage, but without looking at your finances, you're just, setting yourself back. But you have to look at your finances. So set boundaries, you have to look at yourself. And sometimes it might require therapy and sometimes it doesn't. Sometimes again, people might be like, what, I know what I want. I know what's going on, self-reflection, they're fine. And other people have to do therapy because they have to understand about childhood, childhood experiences, potentially, developmental trauma or like childhood abuse, emotional, physical, even like sexual abuse that might impact somebody's self-esteem that could have happened from a peer, that could have happened from somebody else in a position of authority, whatnot, teacher, things like that. So really to understand what prevents one from having boundaries, right? And then, that's kind of the first part. It's kind of truly understanding yourself. And then that's like understanding your finances. And then you will have to know what boundaries do you need. Again, that's like telling the real estate agent, I want a house. They're going to ask you, well, how many bedrooms, how many bathrooms, what area, right? Like you can't just show up to the real estate agent and say, I want a house. I got to for 400,000. I want a house.
You have to be specific. You
have to be specific, right? And you have to give priorities to what, do you want particular area? Do you want number of bedrooms? What do you want, right?
Yeah.
These are the questions. So if we accept that as normal for buying a house, we need to understand that when we're talking about setting boundaries, it's the same things. After we figure out who we are, we have to understand what boundaries we want. We also have to understand what is the priority of the boundaries, which one, to tackle first, which one can be delayed for later. And again, as we're talking about boundaries, we also have to understand who's going to support us, who's going to be a barrier. again, when you're buying a house, you kind of have to be on the same, place with your potential partner, spouse, or, maybe family members, about what area or what you're willing to spend. You might think this way and your partner might be completely different and undermine your ability to spend. So it's the same thing. If you're going to be setting boundaries with somebody, who in your life may need to be aware, they don't have to give you approval, but even to recognize that, are they going to be a support or are they going to be a barrier? Because if you're going to set boundaries at work and the cost of boundaries might be that you lose your job, is your partner or whoever else in your life able to support you if you lose your job, or are they going to not support you and you have to count yourself on your own finances to, tolerate that, right? Or are they going to be a barrier to you because they're going to be continuously invalidating your boundaries and saying, you shouldn't do this, right? Like, so we have to be realistic about that too. And we always have to look at the cost of boundaries, because everything has a cost, right? There's a cost to not having boundaries and there's a cost to setting boundaries.
Yeah.
And we have to be in a place to afford those boundaries, meaning that we have to anticipate, that we might lose a friendship or relationship if we say no. We might, lose a job, or we might have to leave a job because it might be unsustainable after we say no, right? Because again, most people don't react well to when we set boundaries, because when we say no, we somehow inconvenience them. And unfortunately, very few people at this point have emotional intelligence to understand that somebody inconveniencing you is not a rejection or a punishment to you. It's just their needs are coming first, right? Me saying, no, I can't do 6:30 for this podcast because something else came up is not a rejection of you. It's just expression of my needs, right? But many people will see it, oh my God, it's a rejection. So again, we have to look at the cost if we can afford it. And what's the cost of not setting a boundary? What's the cost of not setting boundary today versus, a year from now or 5 years from now? Because we always forget that cost of not having a boundary. And that might be time, that might be missed out opportunities in our life that we can't get back, especially with our children who are continuously growing. We can't get back when they're 5 again. We can't get back them being 10 again. That's just not going to happen. We can get another job. There's always jobs.
I love that you make the analogy to finances, because that's something that it's non-negotiable. In order to optimize your quality of life, we're not afraid to dig into our finances, our credit score, our spending habits, our savings. Those are all things that we are willing to look at and investigate and optimize in order to improve our quality of life. And yet when it comes to learning and setting boundaries for ourselves, that's almost like not as easy. It's more difficult because a lot of self-exploration is involved. And like you said, I think you really do have to be comfortable getting to know who you are, what you want, and what you're willing to do and not do. I think it's really interesting that, you made that analogy, because those are two components of life that are starkly different. And yet we're not afraid to approach one, and sometimes digging into our personality or our evaluating our own needs is scary and difficult. So when you are preparing to set boundaries, maybe for the first time, when you're preparing to tell someone that, you're in a relationship with, whether it's a friend or a work colleague, and you're preparing to kind of assert that boundary, like you said, you're going to need a little bit of confidence to accept that you might be rejected, that you might inconvenience that person or make that person's life more difficult. But how do you prepare for the reaction of someone else? If it's your first time really, asserting yourself and saying, hi, this is what I need. This is what I'm willing to do or not willing to do anymore. How can you prepare for that? How can you prepare for the reaction that someone else may have when you announce your needs?
Well, and again, obviously this is not based on any specific, situation. I can't give any specific advice, but in general, you kind of try to start practicing your skill in a setting where it's like low cost, low impact, and, you're kind of more likely to succeed to see what it feels like. Again, when you're starting investing, you're not going to be like investing $50,000 ideally. You start slow, you start low, you see how it feels, and you kind of go, right? It's the same thing with boundary, so maybe you're figuring out in your life, what is a boundary that has the least cost and the most supportive environment possibly. So again, potentially setting a boundary about dinner time with your friend. If your friend asks you to go at 6:30 and you might say, well, my friend, is usually supportive. If I say, no, I can't do 6:30, it's late to me, can we do 5? That's a boundary, right? You're setting time boundary, and it's small stakes for most people.
Sure.
It's more likely that somebody that they might succeed or they might not. Like, again, the simplest boundary might be the most difficult one, right?
Right.
So you kind of try to start with something small and slow in a supportive kind of relationship, in the relationship that you think is supportive, like friends, things like that. But it might not be, right? And remember, we usually look and we predict other people's behavior based on our past interactions with these people.
Yeah.
But sometimes it might be completely unpredictable. Sometimes, again, say no, somebody could turn around and say, you're difficult, what's wrong with you? Or somebody might say, that's a good point. Kind of like you did, right? Like when I pointed out about the food, you turned it into a learning point versus thinking I'm criticizing you. And so sometimes people are like, I actually never thought about it. I could see your point why you're not available or whatnot. And it's a point of growth for both involved rather than a point of conflict and, relationship issue of any sorts. So that's kind of the general advice. But so there could be usually predictable responses based on other people's, previous behavior, pattern of behavior, or an unpredictable behavior. And everything we do, if you look at it from how can we grow from this, it also kind of helps us build up the confidence, because the reality is if you set the boundary and somebody reacts like you did and says, well, that's actually a good point, both people grew, the relationship gets stronger, you move on, it's collaborative.
Yeah.
If you set a boundary and somebody's like, I can't believe you asked me to move dinner to 5 o'clock, you're so selfish. Yeah. If that is what makes them think selfish is moving at dinner time, imagine if there's actual real issues in that relationship or real stressors come up. Is that a person that you want to call a friend, right? So that helps you grow in understanding this friendship or understanding who this person is. Because there's a difference between what people tell us who they are to how they demonstrate who they are through their actions. Because, I could say I'm athletic. And I mean, I do go for a walk occasionally, but, my walk is like down the street with the dog. Until you ask me to start running marathon, well, that's a different story.
No, I think it's interesting that you mentioned that. And as you're speaking, I'm thinking to myself, that relationships could be at stake if you are going to start to assert yourself in a way that protects yourself, that people aren't used to. And so maybe being prepared for that is a good way to go into it. Although I feel like there's probably a way to communicate things to people in your life who are closest to you and that, relationships that you're really concerned and invested in preserving, of just saying kind of like, listen, my needs are changing. I need to say no for these reasons. And, I hope that you can support me in that. There's gotta be a way to present your boundaries in a way that's, in a way that doesn't make it feel offensive.
But it's not offensive. Remember, the boundaries are not offensive if you're presenting boundaries versus, you're punishing somebody. But what it might reveal is an inherent conflict in the relationship that cannot be overcome. And here's the thing. Everything has a conflict. Conflict is normal. Conflict is not bad. It's the behavior because of the conflict that's a problem. It's how people manage conflict. Conflict is totally normal. It's absolutely normal, right? Look, we could have had a conflict of interest if I had, if my patient was running late and I wasn't able to log in at 6:30, and it's not bad. It's not anything. It's because, my patient's needs might have been outpaced what I had booked for him. So what happens is that imagine if you have a relationship based conditionally on your unlimited availability. So imagine that if you have, let's say, work, and people call you constantly because you're the one who's taking shifts, or you're always the one who's answering the phone to help problem solve, right? Because you have the skill, you have the skill, and they really need your skills. So they constantly call you, call them, right? So it becomes a relationship based on you not having a boundary, because they'll call you or they text you on your way. Again, as physicians, think about it. People call you, can you come in extra? Can you stay late, right? And then you say, okay, guys, unfortunately, I'm no longer available. I'm not answering the phone after 5.
Yeah.
Well, now they're not going to call you, right? Because you're not available. So your boundary of 5 o'clock wasn't offensive, but your boundary was saying, I'm not available. And now they're not going to call you. So that relationship might dissipate, not because your boundary was offensive. It's that your boundary does not meet their need, and not because you're bad or they're bad. It just shows you what the relationship was based on. That's what happens with us sometimes when we say, oh, I'm friends with somebody at work. But most of the time we get together around work events or complaining, venting about work issues, or like helping
Yeah.
each other work. Then you move on to a different workplace, and all of a sudden, you don't have anything in common anymore. Or you might set a boundary about what you want to talk about. You might say, I don't really want to hear about all the problems of the previous work. And then you realize, well, we don't really have anything in common to talk about, because you realize that most of the time that you spent together that you thought was friendship was just venting about the issues of work. So that friendship might not go anywhere anymore, because you actually realize that what kept the friendship going was venting and problems in the workplace.
Yeah.
So the boundaries sometimes reveal what is the true glue for that relationship. And by relationship, I mean everything. I mean, dating, I mean friendship, I mean work relationships, any relationship.
Sure.
Or they test the strength and the negotiation ability and problem solving ability and accommodation ability of a relationship.
Oh, I love the way you put that. I really do. These are things that, these are things you read about, and people write articles about, and there's coaches and people out there kind of cheering you on, saying this is what you should do, and these are the ways you should approach your life in order to preserve your best interest. And yet I think it's really difficult to figure out how to approach that, or what to expect if you're going to start to put up some boundaries in your life. I am a person, I would rather roll over and die than, participate in conflict. It's very difficult for me. And, I'd rather keep the peace and suffer, or, take on extra, whether that's emotional baggage or conversation or time or extra work. I'd rather do that than have there be some sort of conflict. And that's only to my detriment. That's not an advantage for me to say that I like to avoid conflict. And so I think it's interesting how you talk about approaching it, and how you talk about what those relationships in your life might reveal. And going back to what you were saying originally, if you know who you are and you know what you want and what you're willing to do and not do, then you might just learn that some of these relationships or arrangements that you're a part of might not be suitable for your life, or may no longer be acceptable for you to participate in.
Right. They may not belong at this point. They might have been useful in the past, and people are not bad. It's just at this point, they're no longer aligning, your needs and this boundary and what the other person wants may not be aligning. But also, again, it goes back to how we define conflict. Conflict is normal. Think about pregnancy and birth. It's a conflict. It's a conflict between mother's health and well-being,
Sure.
The pain and everything else we have to go through to have the baby, and, the well-being of the baby. Like, think about it, like our body goes through this change. Like every woman who has given birth has some kind of damage to their body. And, that's if there's tears, if there's pain, if there's any other issues, C-section, like our bodies are just not the same. We're not saying it's bad, but we have to be realistic that once you gave birth, whichever way you did, there is permanent change in your body. Right. Sure. So there's a conflict of interest between what your body wants and needs to what the baby needed to grow and come out of you, right? Baby needed your body to expand and stretch your organs and everything else. And you were uncomfortable when it was happening. Like I remember being short of breath when I was pregnant and not being able to talk in a full sentence, right? At the same time, my baby obviously was expanding and needed the space that, was occluding my lungs. So that's normal conflict, right? So what do you do about it? Like, how do you manage? Think about, again, as a parent, you're sleep deprived, you want your sleep. At the same time, you're going to be waking up and feeding that baby, or you might have to have a nanny or somebody to do that. But that's a conflict of interest and needs. Yeah. What the baby needs to what you need is not lining up. But most of us are like, oh my God, we're kind of managing. And so that's what we have to understand, that conflict is normal. What people are usually intimidated by is other people's behavior around it, and the blaming, the rejection, the attacks, and all the other unhelpful strategies of mitigating conflict, right?
Such good stuff. I love it. When you talk about children, you make a great example. I look to the generation, like my children's generation. I don't know how old your kids are, but I have a 15, 12, and 7-year-old. And I'm always in awe of these younger kids and the confidence that they have and the way that they function in the world that they're handed. Basically, I feel like we as adults don't necessarily even handle the world around us as well as some of these young kids do. And so my next question to you is, as an adult who might be afraid or uncomfortable setting boundaries, what are some strategies to help our kids or be comfortable with our children setting boundaries for themselves? How can we support them as they set their boundaries if we're not comfortable? Any strategies there? Because they're confident.
I know, but we have to do our work. We can't, because again, if we don't know how to manage finances, we can't teach or answer our children's questions about finances, right?
Yeah.
So think about the conflict of interest between boundaries, right? So let's say, I give this example all the time, the other day, a while back, I wanted my daughter to wear this dress that I bought that I really liked. I was like, oh, this is great, and she's like, no, I don't want to wear this dress.
A great example.
Right? And that's her boundary. Like, she's not interested in the dress. She's not interested in this. And I have to manage my own disappointment and respect her autonomy that this is not what she wants. Obviously within reason, right? Like if it's -20 and she wants to go in a dress, like, no, because of the weather, you have to wear weather appropriate clothes. But, I have to manage my own disappointment to allow her to have boundaries, right? Or if my child says no, if my child wants time, I have to manage the conflict of me not having time or having to delay something else so I could talk to them or attend to their needs, right? And like respect their boundary. So it's huge, right? Like we do have to know how to manage our own stuff and manage our own reaction to boundaries. So we don't see our children's boundaries as a sign of rejection, or like if our child doesn't want to hug us or give us a kiss or wear the dress. Like, can you imagine if I told my mother I don't want to wear the dress that she's picked out for me? Right?
Exactly.
Right. It's completely different, but that was their generation. So, and it goes to, younger employees we have, or like, when I have medical students and my medical students like, well, I have to get off at this time to attend this meeting. Okay, well, it affects, what I need to plan for the day or the teaching. At the same time, I'm like, great, they're able to tell me no, and they're not afraid. Like, this is awesome, and like I'm accommodating for the inconvenience of them having that particular window away from my clinic. At the same time, I'm proud that they're able to say no and attend to what they need to.
Yeah. When you bring up the, children kind of asserting their wants for how they appear in life, whether it's a 6-year-old wanting to wear a dress or not, or, there are larger issues at stake there, with respect to identity and, their confidence in how they want to appear in the world, whether it's physically, or how they want to behave, what they want to say and do. And you talking about dress is kind of like a smaller example, or I would say less consequential example. I'm thinking about how sometimes parents expect children to not put up any boundaries around physical touch.
Yes, exactly.
Hug your grandfather, give so-and-so a kiss, or, and we don't even ask them necessarily if that's something that they want to do. And if they say no, it's kind of like they're made to feel bad about the fact that they don't want to be physically close to someone that, whether they're not comfortable or they just don't want to, so we kind of like pressure them. And that's something that is our problem, not theirs. Like, they're comfortable saying, I'd rather give you a handshake or a high five. And we're kind of worried about how that other adult is going to perceive the fact that your child is being difficult.
And judging us as the parent. When, when I tell my patients and like, my parents, they say, look, if that child had a relationship with that adult that made them have that warm and fuzzy feelings that they want to hug, they would have hugged that. If that is an uncle that shows up once a year to Christmas, or a grandfather who's cold and crusty or doesn't participate in their life, and the child has no emotional need to give them a hug, we're forcing a relationship that doesn't exist, right? Yeah. And what we're dealing with is this reality that this adult does not want to face. Because if you're an uncle that shows up once a year at Christmas and you expect a hug, did you keep up the relationship for the entire year so that you could actually earn a hug? Or are you just expecting based on your role because you're an uncle, right? And that's what we're forgetting, that again, our behavior often conveys more about the relationship. So if a child doesn't want to hug, they're not comfortable, or they don't have a relationship with that person.
Yeah. Or they're
Don't
just not in the
force it.
mood.
Or they're not in the mood, like they're not comfortable, right?
Yeah.
But again, we'd rather save the face of the state of the relationship rather than face the reality.
Yeah. And those are difficult things. Those are difficult emotions to face. Those are difficult conversations to have, when you're in the room at a family holiday and there's, something that people will talk about or people will notice, there's always you're always afraid of having the spotlight being shown on you in a negative way. So I just think,
are you talking about Italian Christmas dinner?
You better go macaroni. I think of my grandmother, when we would show up to her house because she lived a couple of hours away, she wouldn't even say hello. She would say, "Did you eat? Are you hungry?" And then if you did not eat, it was like the worst thing ever. It's funny. It's all a reflection of us. And so I love these conversations because we're talking about things that people don't talk about, that people want to be able to learn how to do, that maybe they don't have the confidence or the skill set or even the awareness that it's possible. There are women out there listening or who maybe click on this episode and think, don't even haven't even considered the concept that setting boundaries is an option for them. And so I love having these conversations, especially with experts who can put it into language that's understandable and empowering. So I really love the work that you're doing. And I so appreciate you being here. Can you just please tell my friends who are listening where they can find you if they want to get more information, learn from you, work with you on the internet or virtually?
Absolutely. So I do have our Instagram. So I have my company Triumph, through which I do the coaching and educational sessions as well. So Triumph Leader Coach is our Instagram handle for that. And I also do Dr. Mom Life in Canada, where I do a bit more parenting, a little bit more physician health topics, which are relevant to most professional women because there's a lot of similarities, but definitely a lot more kind of mom-focused, parenting-focused stuff will be on my second handle. And we are writing, we're almost done the book. We're just doing editing about boundaries for physicians that cover all of that, including boundaries with family, boundaries with everything else. So not just at work. But again, and down the road, we might do another one for professionals, professional women. But, again, it's a very complicated topic. And I think this is why it's not easily solved or easily, done. Just like finances, you don't finish, your financial stability in 1 hour, 2 hours. And if, people promise you to fix everything in 8 sessions, again, can you fix your finances in 8 sessions? Most of us cannot learn all about finance in 8 sessions. There's so many layers, right? So I think it goes back to the boundaries, right? Making sure that people make informed decisions about who they get their information from and what's the background of people, who are providing this information. Because unfortunately, our coaching is unregulated. There's no boundaries. Again, when people are licensed therapists, there's boundaries, there's ethics and there's regulations that kind of create boundaries around what's offered. And same with physicians. But with coaching, that's where it's a bit tough. So doing your due diligence and understanding what is actually appropriate for coaching or not, and what is the boundary for what the coach is focusing on or offering is really key. So that's my other kind of last pearl as we wrap up.
Well, I always enjoy speaking with women physicians who I feel like I have a lot in common with outside of medicine, working moms who are facing all the same challenges that I do. And I just really appreciate that. If nothing else, this conversation just empowered our listeners to explore and evaluate and think and meditate on what you want for your life, how you want to exert control over your life, and to understand that you can learn those skills, that there are people out there like you who are ready, willing, and able to help you discover your potential and your own power. And I really appreciate you just shedding light and sharing your expertise in this subject. I hope that we can get together again soon, because I feel like there's so much more that we have to learn from you.
Totally. Anytime. Let me know. I'd love to come back.
Thank you so much.
Lots of parenting stuff to talk about.
Thank you, Dr. Mammoliti. Nice to meet you.
Nice to meet you too.
Bye-bye.
Bye.